Hi everybody, on today's episode of Celebrity Secrets, we're going to be talking about Bella Hadid. She recently came out with an article in Vogue magazine last week saying that she regrets having her nose done at the age of 14. So why is this an issue? You definitely want to wait until your body is skeletally mature before proceeding with surgery, specifically with a rhinoplasty. Most patients have issues with a bump or the width of the bridge and the bones and the structures that are still continuing to grow during puberty. Most women finish puberty around 16, 17, and most men finish puberty around 17, 18. So being a 14-year-old means that she's still a couple years away from full maturity, which means that if the rhinoplasty was done at that time, the nose can continue to change and potentially grow. Therefore, it's always imperative to make sure that the patients are fully mature before proceeding. Again, in this article, she talks about regretting having the surgery so early because she feels that her nose might have grown into her face as she has progressed through the ages. Which brings us to the next point. As you can see from these photos, Bella Hadid has changed facial structures throughout the last few years as she's matured. A couple of the big things that we've noticed are our higher arching brows and the fox eye look that most patients are looking to get these days. She claims this to be from face tape, which absolutely can be true. But for those patients who are looking for a more permanent appearance like this, in a surgical fashion, a couple things that we can do. First of all, it's called a lateral brow lift, where the brows are lifted up and that brings the eyebrows upwards. Secondarily, in order to bring the size of the eyes up, is to do what we call a canthopexy, or kind of taking out the ligament and moving it upwards to provide that more fox eye look. So both of these can be done to give you that, again, fox eye appearance, lifted brow, lifted lateral eye position. So the next big transformation you see with Bella Hadid's face is that her face went from more of a round, cheeky look to a more narrow, contoured look to her face. This could be achieved in a couple of ways. First of all, absolutely she could have lost a little bit of weight. Again, as we're younger, our face does look rounder or more chubbier. She could have definitely lost some weight. And again, in the article with Vogue, she talked about having to lose weight because she couldn't fit in a Yves Saint Laurent dress. So I'm sure she had a lot of pressure going through her weight changes. But losing weight can cause diminishing of the facial fat in her face, creating this more contoured look. For those patients who are looking to have this achieved more permanently and quickly, a couple of things that we can do is something called a Buccal Lapectomy. So a Buccal Lapectomy removes the fat from the lower cheeks here to give you more of that slender, more shaved look, to give you more of that shadowing that a lot of patients put on their face using makeup. So that can be done permanently using, like I said, a Buccal Lapectomy. Additionally, to create the higher cheekbone look and the more prominent chin look, fillers can be placed, or even fat grafting can be done to augment the volume in the cheeks and the chin to create more of this heart-shaped look. So she went from more of a round-shaped face to more of a heart-shaped face with fuller cheeks and lower cheeks tapering down to a nice full chin. Lastly, looking at her before and after photos, although it's very subtle, you can notice that her lips have changed volume as well. Again, not saying she did anything, but this can also be achieved for those patients who are wanting to have fuller lips with fillers. Fillers are materials that augment the volume. Again, just like the cheeks or the chin, this can be placed in the lips to create fuller and more voluptuous lips. A Botox lip flip can also be done by placing a few units of Botox to the upper lip, which weakens the muscle and rotates the lip upwards as well. So Bella Hadid is now 25 years old. They're comparing her photos from 25 to when she was maybe 17 or 18. So you can see kind of some of the changes that she's undergone over the last 7 or 8 years. The point of this video is to let patients know that it's important to make sure that you're skeletally mature, number one, and additionally to make sure that any weight gain or any weight loss that patients are planning on undergoing is stabilized and you're at baseline before proceeding with surgery. Because oftentimes what can happen is either the face or the body or whatever areas we're looking to change can shift during these times of your body changing. So it's important that your body is stable before proceeding with surgery. Thank you for watching. I hope this was educational. If you guys want more content, please subscribe below and tell me what you guys think.